Karen Harper's head-to-toe assessment.
Come in.
Hi, my name is Karen. I'm a nursing student at the University of Detroit Mercy. I'm just going to go ahead and do a head-to-toe assessment on you. Can I see your first? Can you tell me your first and last name?
Jenna Volkak.
And your date of birth?
7/16/95.
Okay. And do you have any allergies at all?
Nope.
Experiencing any pain?
Mm-mm.
Okay. I'm going to pull the curtain and provide privacy and go ahead and wash my hands. Do you know where you are?
Yep, I am at the clinic.
Okay. And what is the season?
Spring.
Okay. Let me hear.
2013.
Okay, so client is alert and oriented ×3. There's no obvious signs of illness. Overall hygiene is appropriate. No signs of obvious illness. Okay, so I'm going to go ahead and start. Speech is articulate. Mood is appropriate for situation. No obvious facial drooping. I'm going to start by inspecting the hair. So there's no lesions on the skull. Texture is good, nice and thick hair, no lice or any other dandruff or anything like that. If there was a lesion, we would use A, B, C, D, E. Asymmetrical, border, color, diameter, and elevation. Okay, so I'm going to go ahead and palpate your skin for temperature. Even throughout, a little warm, nothing abnormal. So I did state that the client was alert and oriented ×3. So I'll go ahead and look at your eyes. Can you follow the tip of my pen for me? Okay, good job, thank you. And then go ahead and keep following the tip of my pen. I'm gonna go ahead and look at my notes for me. Good job. Okay, good job. So eyes are perla. Make sure check the conjunctivi. So sclera is white, conjunctivi is pink, no inflammation. So I'm gonna go ahead and look inside the mouth. So mucosa is pink and moist. Go ahead and stick out your tongue for me. Can you say ah? Ah. Okay, so tonsil would be a +1. No inflammation, and uvula is mobile. Teeth are all present. There's no cavities. Gums are intact, pink, no lesions on them. And can you go ahead and smile for me and puff out your cheeks? Okay, so that's testing cranial nerve 5 and 7. And go ahead to check for JVD. And then the other side here. Okay, good. And so face is symmetrical, eyes are symmetrical, no obvious face drooping. Okay, skin color is contour, good for appropriate for ethnicity, no lesions. Temperature was warm, but same on both sides bilaterally. So I'm going to go ahead and check your brachial pulses. Okay, good. And your radial. One side here. Both are bilaterally +2. Go ahead and check your fingernails for capillary refill. And this one. Okay, capillary refill is less than 3 seconds. Go ahead and check for clubbing on both hands, no clubbing present. Can you go ahead and squeeze my fingers for me? Okay, so strong muscle strength, appropriate. I'm going to go ahead and palpate your carotid artery here. And this one. Okay, and I'm going to go ahead and listen with my stethoscope, my bell. Make sure there's no good swishing sound, no buoys. On this side. Okay, good. Okay, so now we're going to look at the heart. So, over and go ahead and name the places, what they're called, then the location, and then we'll go ahead and listen. So this is the aortic, pulmonic, herbs, tricuspid, and apical. So aortic is located on the right the right sternal second intercostal space. The pulmonic is left sternum second intercostal space. Herbs is going to be left sternum third intercostal space, and tricuspid is also going to be left sternum fourth intercostal space, and the apical is going to be mid-clavicular fifth intercostal space. So I'm going to go ahead and listen to the apical pulse for 60 seconds with my bell. Well, actually, first I'm going to go through and listen with my diaphragm. So you can just breathe normal. Yeah. Okay, and I'm going to go ahead and listen to your apical for 60 seconds with my bell. Okay, I'm going to work my way backwards with my bell also. Okay, and you'll hear the S2 in your aortic and your S1 in your apical, best sounding heart sounds. Alright, and so now I'm going to go ahead and listen to the lung sounds, 10 places on the front and 10 places on the back using my diaphragm. So every time I touch my stethoscope to your chest, give me a deep breath for me, okay?
Okay.
Okay, now go ahead and listen to the back side of you. So same thing. Seven, 8, and 2 on the side. 9, 10. Okay, all those sounds are clear. No wheezing. Go ahead and lay on your back for me. Actually, while you're up, I'm going to go ahead and check your costovertebral. Just tell me if you feel any tenderness at all.
No.
Okay. Alright, now you go ahead and lay on your back for me. I'm going to check your anterior posterior diameter, which is 2 to 1. Okay, so now I promise you can lay on your back. Alright, so I'm just going to go ahead and look at the abdominal area. No swelling, no redness, no scarring. The color is still appropriate for ethnicity. So I'll go ahead and name the 4 quadrants. So this is your right upper quadrant, this is your left upper quadrant, this is your right lower quadrant, and your left lower quadrant. So up here you're going to find the kidney, gallbladder, and liver, and half the stomach. Over here you'll find the other half of the stomach, the the kidney, a pancreas, and the spleen. And the other half of the stomach, I don't know if I said that. And down here you'll find, up here was the ascending colon also, and transverse. Down here you'll find the ascending colon, the cecum, the appendix, and that's about it. And half the urethra and bladder. On this side you'll have the other half of the bladder, the descending sigmoid colon, and that is it. And so now I'm going to go ahead and listen to all quadrants of your abdomen. Okay. So there are vowel sounds in all 4 quadrants. So I'm going to go ahead and palpate and you tell me if there's any tenderness at all.
No.
Okay. And percussing, we would hear some dull sounds over the liver and spleen, and the rest is tympanic. And I'll have you sit up for me. So I'm going to go ahead, and I did check the JVD earlier, so I'm going to go ahead and examine your lower extremities, so check skin temperature. Good, color is good. There's no swelling, no pitting. Temperature good bilaterally. So I'm going to go ahead and check your popliteal artery here. +2. And the tibial. Okay, good. +2. And the dorsal pedis. Okay, good. +2. So I'm going to have you go ahead and stand up for me. Okay, while you're sitting, I'll check the Babinski test. So it's negative. Anyone over the age of 2, they'll be negative in. So go ahead and stand up for me. I'm going to have you stand in front of me with your feet together, legs, arms at your side. Go ahead and close your eyes for 20 seconds. I'll be behind you in case you feel dizzy power. Okay, good. I'm just going to ask you to walk to that wall and back to me. Okay, so patient's gait is steady, no abnormalities. Did you feel dizzy at all when standing or walking?
No, not at all.
Okay, not a balanced or the Robert test.
Mm-mm.
Okay.
All right. Thank you.
Yep.